Geographic atrophy is a form of age-related macular degeneration. Historically, macular degeneration was divided into two forms, a dry form and a wet form. Geographic atrophy is a subset of the dry form of age-related macular degeneration. It is typically bilateral, meaning it affects both eyes, and progressive, meaning it worsens with age. The major risk factors for developing geographic atrophy include a patient's family history of age-related macular degeneration, their genetic makeup, and also advancing age. The atrophy in the term geographic atrophy refers to cellular death of a patient's retina in certain layers, which include their photoreceptors, the retinal pigment epithelium, and their choriocapillaris. In terms of how geographic atrophy affects a patient's ability to function, in the early stages, this condition can actually be asymptomatic. However, as it progresses, geographic atrophy can affect a patient's ability to see clearly in the distance and also up close. In its severe forms, it can affect a patient's ability to drive and obtain a driver's license. It can affect a patient's ability to read, and also can affect an ability of a patient to recognize people's faces. The diagnosis of geographic atrophy is often made in a doctor's office by an eye care professional. The doctor will typically use a slit lamp examination and other bright lights to examine the retina. Additionally, more advanced imaging can be performed to identify geographic atrophy in a patient's retina. If you look next to me, there's a picture of geographic atrophy in a color fundus photography. This sort of picture is done frequently. You can see an area of geographic atrophy right in the center, where there's a large spot. Oftentimes, geographic atrophy starts as smaller spots when the patients are asymptomatic, and then these spots can grow with time, and often they'll coalesce into a larger spot and affect the central vision. Other imaging techniques that can be done are a picture called an OCT. In this exam, you can see areas where the patient's outer retina is damaged by geographic atrophy. This picture gives us a cross-section of a patient's retina. Additional imaging modalities include a fundus autofluorescence, which really highlights the difference between healthy retina, which is on the outside of this large dark spot, and damaged retina by geographic atrophy, which is the large area that's dark in the center. Treatment of geographic atrophy should be discussed with an eye care professional in your doctor's office. It's important that this condition is followed in the long term so that any sort of progression can be monitored and treatment can be provided.